Knee replacement surgery is one of the most successful and effective treatments if you have knee pain and joint stiffness. If you have knee pain or damage to the knee that is localised to just one area of the knee, then you may be considering a partial knee replacement. In this video, I'll explain why your specialist may suggest a partial knee replacement, the benefits of a partial knee replacement, and in which cases a total knee replacement is needed. I'm Graeme Hopper, Consultant Orthopaedic Knee Surgeon at Ross Hall Hospital, part of Circle Health Group, the largest private healthcare provider in the UK, with over 50 hospitals across the country. Knee replacement surgery is a very successful and common procedure, as it quite literally replaces the damaged joint. It's worth mentioning though that you don't always need surgery to relieve chronic knee pain. Sometimes joint pain can be managed with medications, physiotherapy or steroid injections to help with inflammation. If alternative treatments don't give you enough relief over time, then you do have the option of knee replacement surgery. Do remember that talking to a surgeon about knee replacement treatment doesn't mean you're committing to surgery. It's simply the chance to understand the various options available to you to help you make the best decision for your unique body. We'll go into more detail on what exactly happens during partial knee replacement surgery a little later in the video. I'm often asked, why would I only have a partial knee replacement? Is it better to have a total knee replacement? A partial knee replacement, otherwise known as a unicompartmental knee replacement, is a good choice if you have arthritis in only part of the knee and no arthritis or minimal arthritis in the other side of the knee and under the kneecap. Your specialist will have suggested a partial knee replacement only if you have localised arthritis or localised damage due to gait abnormalities, trauma or injury. Anatomically speaking, medial refers to the inside compartment of the joint, which is the compartment nearest the opposite knee. Lateral refers to the outside compartment farthest from the opposite knee. Degeneration of the medial knee joint is by far the most common in people with arthritis. Your specialist may suggest a partial knee replacement if taking painkillers is having no effect and you're maintaining a healthy weight. In my practice, prior to making the decision regarding suitability for a partial knee replacement, I will have ordered various x-rays and sometimes other scans and assess the range of motion in your knee as well as the stability of your knee. To be able to have a partial knee replacement, your anterior cruciate ligament should be intact and you should have a sufficient range of motion in your knee, meaning you'll be able to bend and extend your knee almost fully. In short, you're the best fit for a partial knee replacement when you have damage to only one compartment of the knee joint and you have a stable knee. Ultimately, your surgeon will take into account multiple factors to decide if you're best to have the partial prosthesis. The reality is that if you have osteoarthritis that requires knee replacement surgery, then more than one area of your knee joint could be affected, and a total knee replacement is the preferred option. However, if your pain is only on one side, seeing a consultant that offers partial knee replacement can be well worth your time in understanding whether partial or total knee replacement is best. The literature suggests an estimated 25 to 47% of patients listed for a total knee replacement have isolated unicompartmental arthritis and would actually be suitable for a partial knee replacement. Compared to a total knee replacement, a partial knee replacement better preserves range of motion and knee function because it preserves healthy tissue and bone in the knee. Essentially, a total knee replacement is a bigger operation where a larger incision is required, more soft tissue is disrupted and more bone is removed from the knee joint. This is not always necessary for those with isolated arthritis in only one part of the knee, and a partial knee replacement avoids removing parts of the knee that are not bone. Partial knee replacement surgery is usually performed under a spinal anaesthetic or a general anaesthetic, just like a total knee replacement. Your anaesthetist will usually discuss these options with you on the day of surgery and decide what's best. During the procedure, your consultant will begin by making a small incision on the affected part of your knee. They will carefully remove the worn part of your knee joint using specialist instruments before placing the artificial component known as a prosthesis, which essentially restores the smooth surface we need for our knee joints to be able to glide past each other smoothly. Once your surgeon is happy with the placement and the alignment of your partial knee replacement, They will close your wound using either stitches or staples. They'll apply a dressing across your wound to keep it clean during the healing process. The operation in total takes around an hour, but having your anaesthetic and recovering means you're usually away from the ward for a few hours. Is recovery painful? Yes. Recovery from partial knee replacement can be a challenging and uncomfortable experience. Because a partial knee replacement is a much less invasive surgical procedure than a total knee replacement, you'll generally have a faster recovery time. There's less trauma to the surrounding soft tissues, so healing time should be quicker. In some hospitals, after partial knee replacement surgery, patients may be able to return home the same day, but often a stay overnight in hospital is required. You'll likely feel some stiffness, soreness, swelling and pain in and around the knee joint, which is normal in the early stages. Our team will give you appropriate painkillers to help you with your initial recovery. Your physio will show you how to get up out of bed and to stand and walk safely. Your job, after surgery, is to work through the initial pain and stiffness as soon as possible. Regaining good movement can also help reduce or eliminate any lingering pain or discomfort. The full recovery process usually takes up to 6 weeks. You'll need to factor in physiotherapy during this time in order to get the best out of your recovery, and you'll need to make the necessary arrangements in your home to make these recovery weeks easier. If you're looking for a more detailed video on how best to recover from knee surgery, we have more on our channel where our physiotherapy team talk through knee stability exercises in detail. So, that was a brief run through of why you might consider a partial knee replacement, what's involved with the procedure and how this differs from a total knee replacement. If you want to come and see me for a consultation to talk through your options for knee replacement surgery or discuss any other knee problem you have, then you can book online via the link in the description below, or alternatively search for your nearest Circle Health Group hospital and the next available consultant in your area at circlehealthgroup.co.uk. If you have any questions on anything I've covered in this video, please comment below as we'd love to hear from you. Otherwise, thanks for watching.